I got fired for telling a patient her weight was killing her. Now I practice medicine where the truth is still allowed. They say patients want honesty until it doesn't flatter them. I spent 10 years becoming a doctor, over $300,000 in student loans, thousands of hours in training. I didn't go through all that to become a people pleaser. I became a doctor to help people, and sometimes that means telling them what they don't want to hear. That belief got me fired. I was an attending physician at a top hospital in the Pacific Northwest. Today, I practice in Vienna, Austria, because in America, telling medical truth is now considered offensive. Here's what happened. She was a 43-year-old woman I'd treated for 2 years. Type 2 diabetes, high blood pressure, joint problems. Her labs were getting worse. Her weight had gone up 17 pounds in 3 months. When I walked into the exam room, she was eating cookies and scrolling on her phone. She wanted more meds. I told her that wouldn't fix the root problem, her weight. I said, plainly but professionally, that her weight was causing serious health risks. Heart attack, stroke, kidney failure. She snapped, "Did you just call me fat?" I told her it wasn't an insult, it was a medical diagnosis. Her BMI was 38.6, her weight was killing her. She stormed out and filed a formal complaint by the end of the day. Accused me of verbal abuse and fat shaming. Left a 1-star review online. The next morning, I was in my department chair's office. I was told I needed to attend a patient communication workshop and write an apology letter. I refused. I told the truth, respectfully and clinically. That earned me a formal reprimand. A few weeks later, I was covering the pediatric ER. A 15-year-old came in with severe abdominal pain. Intake form listed a female name. The teen introduced himself as Alex and used he/him pronouns. The parents rejected this and insisted I treat their child as female. Tests showed an ovarian torsion, twisted ovary, a medical emergency. I explained the issue using medically correct terms. Alex became distressed. "I'm not a girl," he said. I told him I respected how he identified, but I had to be medically accurate to explain the issue and save his life. The parents lost it. Demanded a different doctor, threatened to withhold consent for surgery unless I stopped validating delusions. I told them bluntly, "Without surgery, the ovary will die. Delay could cause infection or death." They reluctantly signed. The surgery was successful. But once again, I was called in. Another complaint. This time, I was accused of pushing a trans agenda and undermining parental rights. Another reprimand, removed from pediatric ER shifts. An elderly man with terminal lung cancer asked me directly if smoking caused his illness. His family had asked me not to bring it up. It made him feel guilty. I told him the truth. Yes, it was the cause. His daughter exploded. "We told you not to say that." I calmly replied. He asked me. I won't lie to my patient. The man thanked me for being honest. The family still filed a complaint. That was the final straw. I was told to take a leave of absence or face termination. I chose neither. I resigned. I moved to Vienna, where directness isn't seen as cruelty. It's just part of practicing medicine. I had to pass extra exams and relearn German, but I found my place here. On my first week, I watched a senior doctor tell an overweight patient almost exactly what I'd told mine. The patient nodded, took notes, and scheduled a follow-up. No complaints. Another day, a transgender teen was treated respectfully by name and pronoun, while doctors used correct medical terms. No drama, just good care. The message that stuck. Months later, I got an email from the daughter of the lung cancer patient. She tracked me down to say her father spoke about me often and appreciated my honesty. She apologized for trying to silence me. That mess